Hi, thanks for joining me for Monument Health's Insurance 101 regular office visit. My name is Heather. I'm a population health coordinator with Monument Health, and today it's my goal to help you understand what a regular office visit is, how you get a bill from a visit, how to ensure that you're paying the correct amounts for care, and how long it may take before you receive a bill for that care. One important thing to remember is that a regular office visit or primary care office visit differs from a preventative office visit, both in what's discussed and what the benefits are for that visit. Be sure to check your plan's benefit grid so you know what costs to expect when going to your provider's office. And if you have questions about your benefit grid or what particular benefits are, you can either call us at Monument Health or check out our other video, Insurance 101 Benefit Grid, to learn more. So, a regular office visit is a visit that's focused on a specific injury, such as a sprained wrist, an illness, such as an ear infection, or other medical concerns, such as sudden and unexpected weight loss. These visits usually only address one issue at a time, and sometimes you can hear people refer to these visits as a sick visit. A really great example of this is if your child were to develop pain in their ear. Ouch. This is probably something you want to have looked at. You call their primary care doctor's office to schedule an appointment. If this is a new provider to your child, they've never seen the provider before, or if they've not been seen in a while, the office will want to register them as a patient or update their information. They may ask you to come in early to take care of this. At check-in, the office will determine who is responsible for payment of services. This means they'll check the insurance to see if it's active and determine if you have a copay due at the time of service. Now remember, just because you have an insurance card does not mean that there's insurance coverage. Be sure that your insurance is in good standing, meaning you have your premiums all paid up and any needed prior authorizations in place prior to visits, or you will be responsible for the full cost of the visit. Also, check your benefit grid to make sure you have the correct copay for the visit. Once visiting with the provider will take notes about everything talked about and any diagnosis or treatments that they order. These notes and codes are what your provider uses to bill the insurance for provided care. Visit notes are a permanent part of your medical record and once submitted can only be changed by an addendum. These notes are documented by the provider to tell the reader why the patient was seen. All of these notes are important to ensure that there's a medical record to support any diagnosis or treatment. Providing the provider with full and complete history is the best way to support the provider so that they can support you or your child's care. It is the provider's responsibility to complete these notes, and while you may never see the notes, they are an important part of your care. Once the provider has finalized their notes from the visit, they get sent to the office biller encoder. Keep in mind it can take a few days for the note to be finalized as the provider may be waiting on information like lab results. The biller will then take all the codes from the visit and apply them to a super bill. A super bill is an itemized document listing the details of services provided to the patient. This includes the detailed visit notes and ICD-10 codes used for billing that were documented for your care. This super bill is what gets sent to your insurance company for adjustment and payment. Keep in mind that this process must be completed for every single patient, and it can take several weeks to complete. Once your insurance company receives the super bill, there's several steps that must be taken. First, your insurance company will review the claim for the provider's in-network status, apply their contracted discounts, create an explanation of benefits or EOB, then send payment to the provider's office for their portion of the bill, or deny the claim and send you and the provider a denial letter. If you need more information on benefits or what in-network means, be sure to check out the Benefit Grid video for a more in-depth explanation. So I did mention an explanation of benefits or EOB just a moment ago. The EOB is the insurance company's written explanation regarding a claim showing what they paid and what a patient must pay. If you need to know how to use this tool or want more information on an EOB, please see our Insurance 101 explanation of benefits video. Once the provider's office gets their copy of the EOB and payment from the insurance company, they apply these to the bill for your child's regular office visit. Remember that you may receive copies of your bill prior to all the insurance being processed, so waiting on the EOB can help you save money and ensure that your insurance is getting applied properly for all of your care. One of the questions we get a lot is how long will it be before I see a bill from a visit? This can vary depending on how long it takes each person to finish their part of the process. At its quickest, we expect to see the providers and claims side of the process take about 6 to 8 weeks. But if things are backed up, it can take longer to get completed. Once the claims are processed, which can be a 4 to 6 week process, they get sent back to your provider's billing office to have bills adjusted. And if the provider's office just had a billing cycle, it may be another 4 weeks or more before you see a bill with the insurance applied, meaning it can be a total of 16 weeks before you get a correct bill. But this can definitely take much longer than that, so just keep an eye out for those EOBs and bills with adjustments. If you ever have questions about this process or feel as though your claims have been processed incorrectly, you can always reach out to us here at Monument Health or directly to your insurance. We're here to help you get the best care at the lowest cost possible. I do want to thank you so much for taking some time to watch this video. You can reach us by phone or email or even have many of your questions answered on our website. And don't forget to keep an eye out for our other videos and make it a great day.